Good morning, everybody. Thank you for coming to this press briefing to launch the BMA's Manifesto for the forthcoming election, standing up for doctors, standing up for health. And that's obviously the main thing I want to talk to you today about. I hope you've all got a copy of the Manifesto together with the accompanying press release. Following some introductory remarks from me where I'll take you through the main points of the Manifesto, I'll be happy to take any questions both on the Manifesto itself and on any of the key issues facing the NHS throughout the coming year. As you'll see, our Manifesto is divided into three sections, each of which outlines the key commitments that we'd like to see from all the political parties. In part one, we call on them to give a commitment to making the NHS sustainable in the long term, and particularly through the next few years of financial challenge in the NHS. So what do we mean by making the NHS sustainable? Well, probably our most important message to the current government and to any future government is to avoid making the NHS a victim of the financial crisis. Obviously, at the moment, difficult questions are being asked about the funding for all public services, but we believe that now, more than ever, we should acknowledge the success of the NHS and recognise the support it gives people and needs to continue to give people, especially when times are hard. A slash and burn attack on the NHS and on its services would be dangerous and short-sighted. It would be a disastrous error to resort to measures such as cutting frontline services and clinical staff at a time when demand for health care will be increasing. Now, we do accept that we need to be realistic about what the NHS can and cannot deliver. The financial crisis means that we need greater honesty from politicians about the tensions, constraints, and difficult choices that exist or need to be made in the health service. So if not on frontline services, where can savings be made? Next year, we are going to be increasing our activity on our Look After Our NHS campaign. We will highlight to politicians and the public the amount of taxpayers' money that's being wasted as a result of the drive for provision of NHS services by the private sector, including the costs of the internal market, the expensive overuse of private management consultants, the hidden costs and restrictions of the private finance initiative, the perverse incentives of payment by results, and the inefficiencies of many of the independent sector treatment centres. And on these issues, you've got a separate briefing paper which gives a few examples of public money being wasted on such policies. In part two, we call for politicians to give greater support to the medical workforce to help them deliver high-quality care. We give specific examples of what the NHS would like to see for the various groups of doctors and students that we represent to help ensure that we have a medical workforce that is fit for the challenges ahead. We want any future government to engage with the profession to a much greater degree in the development of policies, to value medical leadership, and we call for less political interference in the day-to-day work of doctors and other clinical staff, a rethink of targets, and safeguards on the quality and training for junior doctors. And finally, in part three of the Manifesto, we call for a commitment to improving public health. We believe that government action on public health would not only save lives, but also save NHS money in the longer term. Many of the initiatives that we propose would not require large amounts of extra public expenditure. So, for example, in line with our recent report, Under the Influence, we call for increases in alcohol duty, minimum pricing levels for alcohol, limiting the on and off sales outlets, and an eventual ban on alcohol advertising. On smoking, as well as an increase in taxation and a ban on vending machines, we call for those selling tobacco to be compelled to get a licence to do so. And to tackle obesity, we call on the political parties to ensure that the food industry implements a standardized system of food labeling based on the traffic light system. But in addition to that, we've called for action on two other major areas that perhaps wouldn't normally be considered frontline public health issues. Climate change is not just the biggest threat to the environment, it's also a risk to the health of the public. And we warn that the UK will not be immune from that threat. So as part of any government strategy on climate change, we're calling for binding carbon footprint reduction guidelines for the NHS, which is currently emitting about 1 million tonnes of carbon a year. We also argue that effectively tackling climate change could help to lead to improvements in the health of the public. And finally, we call for an informed public debate on organ donation. We believe that an opt-out system where consent is presumed unless otherwise stated, but accompanied by clear safeguards, would maximise the number of organs available for donation and save lives.